Hello and good evening, everyone. This is Dr. Vaishnavi from the team of Voice of Healthcare, and a very warm welcome to all of you joining us live today. On the occasion of National Epilepsy Day, we gather to amplify a conversation that is often overshadowed or misunderstood, but deeply important for millions of individuals and families across our country. Today's session is titled The Epilepsy Journey Life After Diagnosis. When we talk about epilepsy, the focus is usually on diagnosing seizures and prescribing medication. But the true journey begins after the diagnosis, when individuals step back into their lives and face challenges that are far more complex than just medical management. This session aims to highlight those real life experiences, the emotional weightage of accepting a chronic neurological condition, the fear and confusion families often navigate, the stigma that still persists in school, workplaces, and communities, the unique health questions women with epilepsy face, the mental health challenges that frequently go unnoticed, and the difficult reality or limited epilepsy care in rural regions. At the same time, we'll also explore far science and technology has come. Today, advanced imaging, precision therapeutics, neuromodulation, AI driven seizure mapping, and monitoring platforms are reshaping the way we diagnose, track, and treat epilepsy. So, our goal is to shift the focus from treating seizures to enabling people with epilepsy to live with full dignity and confidence. And now it's my honor to introduce the distinguished panel joining us today. Dr. Vijaya P., Head of Department Neurosciences, Lalitha Super Speciality Hospital, Guntur, President, Indian Stroke Association. Welcome to the session, Dr. Vijaya. I think she just dropped from the call, so she'll be joining shortly. Then we have Dr. P. Sarat Chandra, Professor and Head Neurosurgery and Gamma Knife, AIIMS Delhi, President, Indian Epilepsy Society. He'll be joining us shortly. Then we have Dr. Shiva Kumar R., Head and Senior Consultant, Neurology and Epileptology, Manipal Hospitals, Bangalore. Thank you so much for joining.
Namaste and hi everyone.
Miss Varsha, psychotherapist, D. Metley Clinic, Gurugram. Welcome to the session, ma'am. Miss Rupal Mehta, founder and CEO, Med Marvel Software Solution Private Limited, Pune. Welcome
Good
to the
evening,
session.
everyone. I'm honored to be here.
So, we are privileged to have such remarkable leaders and change makers with us. To begin our session, my first question is to you, Dr. Shiva, that what do you see as the biggest challenge in ensuring equitable access to epilepsy care, especially in rural areas?
This is a very important question which you have raised, Vaishnavi. So, as we all know, there is a lot of treatment gap in the treatment of epilepsy between the urban and rural, and the gap is to the tune of about 70%. That means 70% of the people who are living in rural areas don't have access to proper epilepsy care. And so, what are the key challenges here we face when we say the equitable access to epilepsy care? The most important challenge is availability of specialists, what we call it as workforce, what is available for this. So, the most important thing is we don't have a specialized like MDs or even neurologists in many of the places in India where epilepsy is more common in rural population compared to urban population. This is a major challenge what we see. The second thing is transportation and infrastructure for treating such kind of diseases. Transportation means like people who with epilepsy cannot drive, so they cannot drive and come to see a doctor elsewhere, or there may be a limited facilities where they can reach from rural areas to urban places, where most of the epileptologists or neurologists are concentrated in urban areas. And also, we know that many of the government schools and rural hospitals are closing, which is an important concern for us because we don't have a center where we can access these people for the medical care. And the other important things, what we see in clinical practice is availability of the medicines which are used for the treatment of epilepsy, the cost of the medicines which have gone up recently because of the newer medications, and then limited education and awareness that patients should go on, or people with epilepsy should go and treat doctors. Sometimes they go to traditional healers. They think it is not a medical disease. They think it is some kind of an evil possession or a psychiatric disease. So this lack of knowledge, awareness also is an important parameter for us to say there's a lot of treatment gap between the urban and the rural population. And the last and the most important thing, what we are already discussing, the technological barrier. For example, many countries have got very good telemedicine as a source of communication between the doctors who are specialists in urban areas to the rural areas. So this is lacking in some parts of rural area. Even though the mobile connectivity is there, some people even don't know how to use the platforms for teleconsultation, and even awareness that teleconsultation is going to connect them with some of the doctors who are specialists in urban areas. And the last and the most important thing in countries like India, where we are still developing and what we call it as developing nation, we have lower income, we have unemployment, we have lack of insurance, we have a lack of policy makers who can take some decision to improve the care of epilepsy in this. So all these are major challenges what we see in clinical practice, bridging the large gap between epilepsy in rural and urban populations.
Dr. Vaishnavi, you're on mute.
So, thank you so much, Dr. Shiva, for allowing us to understand this gap between the two sectors that we have currently. So, my next question is to you, Dr. Vijaya, that what are the biggest unmet needs for people living with epilepsy in India today?
Good evening, everyone. First of all, let me thank you, VOH, for this nice initiative. So, epilepsy is one of the most important chronic disorders around the world. 1% of the population is affected by it. And in India, more than 50 million people live with epilepsy. And being the low and middle income country category, we have a lot of restraints and constraints. And in addition to whatever Dr. Shivakumar has covered, I would like to say the most important barrier is the understanding of the disease, not just by the public, even our own professional people will have a misunderstanding, as we all know, even MBBS people and primary level care workers. So, most important thing is to have the proper understanding and proper idea about the disease at every level. This will go an important way for the public education, professional education and training, and the healthcare workers training at the primary level, at the PHC level. And the second important thing is, of course, the treatment gap, which Dr. Shivkumar has mentioned. Less than one third people take treatment, I believe, if it is I am correct. And the causes may be many. First of all, it is because a chronic disease, people don't want to take long time. Second thing is the financial barriers. And third thing is accessibility. And myths and beliefs are again go a long way in blocking this treatment gap. The third and most important thing is, of course, having a national policy for India is very important, just like we do for the NCDs. Luckily, as we know, there's a success story with the NCDs, like hypertension and diabetes are being treated at primary level and with free treatments and free checks. Something like that should happen for epilepsy also. These are some of my thoughts. And the technological things which are there everywhere in the world should be also come to India to have a low cost solutions to access the treatment, best possible treatment, and the drug prices should be controlled so they can be given by the government free to the patients. These are few things that the treatment gaps and the understanding gaps and the policy gaps that I think are important. Thank you.
So thank you so much. My next question is to you, Ms. Varsha, that what emotional or psychological challenges do you commonly see among people living with epilepsy?
Sure. I think to start with, I want to say that I'm really happy that we're kind of combining and trying to look at the connection between these two, because often mental health gets neglected in situations like this. So I'm glad that we're using this forum to bridge that gap and look at the link. Because I think mental health comes in repercussions of what you see in the emotional and psychological being come up in every sphere of life. Well, broadly speaking, it's depression and anxiety is something we commonly find in patients that I've seen, or also statistics shows with epilepsy. And how this further has many other folds to it. We often see like a deep sense of fear and a deep sense of worry about what's going to happen to them, because when will they get the seizure, when will they going to have the attack, is something that is not so much in their control, so to speak. So there's a lot of fear around what to do, where to do, how to do, and along with that also comes the embarrassment of what if somewhere I get the seizure, and I don't have anyone with me, and I don't I don't nobody is with me, so nobody knows what to do, and I'm just maybe lying there, or and people are just looking at me. So there also comes a sense of this embarrassment of moving out, which further leads to this way of, we see a lot of epileptic patients that kind of go into a shell, so it leads to social isolation, where they then don't want to step out, and they don't want to go anywhere, especially without anybody. And it's not always possible to have someone tag along with you wherever you go. Whether you're going to the market, you're going to the workplace. So it gets tough for people with epilepsy to move around socially, or even go to social gatherings for that matter, not only your workplace, because of the same fear that I was mentioning about. And so social isolation is something we see very frequently that happens with people that have seizures. And like I said, they find it very difficult to lead a day-to-day regular life. They also don't want to go out to do any activities or fulfill any of their hobbies or desires as well, because of the same fear. And then how they're all connected is how, as a result of that, because you're isolating yourself and unknowingly, it's not that one wishes to do that, but there's fear overpowers so much that there are so many these ifs and buts that keep coming up in one's mind, and that ultimately leads to them also feeling very very moody, very frustrated, very irritated, because there's only so much time that you can even just stay cooped up in your house, in your room. And so we see a lot of these very mood fluctuations or irritability or anger burst outs that also happen frequently there as an emotional reaction to the situation, because we want to go out, we want to lead a regular life, so to speak, want to do things that make us feel fulfilled, but it just feels almost impossible to do. So these limiting movements lead to also, like I said, irritation and frustration in one's life, and then that could and does in many cases also lead to a low state of mood, or sometimes even diagnosed a depression that they go through. And so this is all like a cycle. They're all, like I said, interconnected, and how one tends to lead to the other. So it's important to be aware of these effects also that happen along with our given physical neurological state there. And sometimes you also see difficulty in maybe being preoccupied with your condition and not knowing what to do, how to help yourself. Also see a lot of difficulty in focusing on tasks, or difficulty in holding conversations straight, um, being able to even function to our day-to-day life, which would lead to further a sense of am I even worth anything? It puts a question mark your own self-worth and your own self-esteem. So the feeling of helplessness overpowers then, and you wonder whether I am good enough to even lead a regular life. So it's all a vicious cycle that one tends to get caught up in, and these are the most prominent, like I said, an umbrella emotional and psychological concerns that we've seen with patients of epilepsy, or not only exclusive to that, but yes, definitely there.
So yes, thank you so much for explaining it to us, the mental angle or the emotional angle associated with these condition. So my next question is to you, Ms. Rupal, that how do you see technology contributing to better awareness, education, or follow-up care for people with epilepsy?
First of all, thank you so much for having me here. And as most of the esteemed speakers have mentioned, the epilepsy is a very century-year-old condition, and enough research and clinical evidences have been generated over the years. We are at a beautiful era of confluence of advancements in neuroscience, technology, artificial intelligence, and somebody who has seen, who's been working, in the technology healthcare space. I see technology can drive a lot of awareness at multiple stages of detection, diagnosis, treatment, surgical interventions. and provide a comprehensive care to entire epilepsy treatment protocol, particularly in terms of awareness, digital tools and technology that can make it more aware, like multilingual educational content that can be distributed via WhatsApp for awareness into at multiple levels, starting from the patient, home, caregivers to academic institution, office, workspace, and communities. Particularly, creating the awareness about epilepsy myths and first aid response systems, care instructions, all the videos content can be distributed through digital channels leveraging technology, so that people are more aware and more inclusive environment can be created for the patients at different state.
Correct.
And also over the period we've realized it's not always about initial diagnosis and screening. A lot of issues are faced by the clinical doctors even after the diagnosis has happened, particularly for those drug resistant epilepsy patients. Interventions, clinical pre-surgical evaluation, that's where the technology plays a very crucial role in giving more clinical insights to doctors based on multimodal data. And that's where MedMarvel is focused in giving completely three-dimension view of the brain to clinicians for actionable insights, particularly for to identify source and location of seizures. If the doctors can identify seizure location and source, a lot of these patients can be made seizure free, or at least the frequency of seizures can be reduced through surgical intervention. And that's the area where we believe technology has a lot of power. Artificial intelligence can be deployed for medical imaging and processing of these data sets.
So, yes, thank you so much for explaining the technological point of view, since it was there in the conversation for quite some time now, and we'll be unfolding it more in the session further. So, my next question is to you, Dr. Vijaya, that what changes in the healthcare ecosystem could make treatment safer, more accessible, and more patient friendly, especially for women?
Very good question, Dr. Vaishnavi. So, in the whole gamut of the epilepsy people, the most affected are, of course, women and children. And for many reasons, more than one, just not the medical, but it's the social stigma and the agony they go through, as our psychologist was mentioning. So what we should, and the most important point is, again, uh, um, there is a chance for us to prevent epilepsy in the first place. The commonest cause of epilepsy in children is still birth hypoxia, which is avoidable. So I would like to highlight the importance of safe motherhood and safe delivery to avoid birth hypoxia and cerebral palsy children with epilepsy, which is a totally preventable thing. And we should strengthen, which is already there, that has to be strengthened. And the second important thing is the social stigma during the marriage and for the children. And this has to go a long way. This is very, very strict, very much embedded in the society, that people are afraid to marry a person with epilepsy, though it is controlled, even if it is remote. So many times the parents and the girl goes through a lot of stress trying to hide that, and because of that they go into a lot of more stress, and this becomes a cycle, as they said. So to address this question, we have to bring in our obstetricians, general practitioners, family doctors, pediatricians as well. To everybody should say the same thing. A long time back, not now, now is better. So when I started my practice, when I say nothing to worry, pregnancy can be go ahead and all that, the same person goes to a gynecologist in rural setup 20 years back. They said, no, 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 if you're taking medicines, we cannot guarantee how to abort. That's what people used to say, and it was a very wrong way of dealing with the things. We can have a safe pregnancy, planned pregnancy. This importance should be shared with the not only the doctors and the gynecologists and the public to ensure a safe motherhood and delivery. The second thing that government can do is, just like this polio drops or other that we are doing with stroke and these ones, we can always have a public campaign across India saying that epilepsy is like any other disease. You can live a normal life with it. And with the celebrities endorsing these things, all these are make an impact in the social media world that we are living now. This should be taken as. In fact, we keep telling our patients that Socrates was the most intelligent person and he was an epileptic. Napoleon was an epileptic, and John T. Rhodes, who was a great cricketer, was epileptic. They all led not only normal life but supernormal achievements. So these are some of the facts we should bring to the public by the common forum like NGOs or government officials, and all of us should take it up as a program. And these two are very important things which can go a long way in dispelling the myths in the public and then taking it as a socially acceptable disease. Now, once upon a time, diabetes was very dreaded disease. Now, people don't dread diabetes. They take it, okay, sugar, it's okay, we can deal with it. Similarly, that understanding acceptance should come from the society about the epilepsy.
Correct. So I believe forums like us also would serve the purpose, and conversations like these could also drive some change at some point. So my next question is to you, Dr. Shiva, that how can telemedicine and digital tools help bridge the treatment gap for patients who struggle to reach specialities in tier one cities?
Yeah. So, you know that telemedicine and digital tools have given a lot of help to the doctors. We have experienced during the COVID times also how telemedicine has helped us to reach to the patient. That's an important aspect for us. As I was telling you earlier, that when we have specialists available only in certain group of cities, urban population, it's difficult for everyone to reach to them. So the access is here is either using an app or a mobile device or using a telemedicine, which can be easily done anywhere in this world and you can contact anyone. So, what is the advantage of using telemedicine? One, as Madam rightly pointed out, that diagnosis is very important for us to treat an epilepsy. So, how do we diagnose epilepsy? It's only by history and by seeing the seizure. So most of the time, what we do is we ask them to record a video and share it to us on WhatsApp or something where we tell them whether it is a seizure mimic or an epilepsy mimic, or whether it is a pseudo seizure, which can happen in people who have comorbid conditions like how our psychologist told about depression and anxiety, or we have true epileptic seizures which are not controlled in about one third of the people. So first, the diagnosis becomes very important. Once you confirm that the diagnosis is confirmed through telemedicine or videos or something, then the next aspect is whether to investigate them or whether only to treat them with medicines. The third important thing is to follow up, because follow up is very important. It's a chronic disease, as was rightly pointed out by Dr. Vijaya Madam, that this disease goes on for years together and sometimes lifelong treatment is required in people who are suffering from epilepsy. So monitoring this patient is very important. Someone who is well controlled suddenly becomes uncontrolled. There are many reasons for that. They may not be compliant with medication. They may be having added pseudo seizures. They may be having added psychiatric comorbidities. Or you know that as a vicious cycle, depression worsens seizures, seizure will worsen depression. So these kind of things will happen during the follow-up. So during the follow-up, you have a media where you can access the patient's data. You can look into the old data. You can get the new data, and you see what are the medicines they are compliant, whether they're not compliant, and based on this you can help them to bridge the gap. The second important thing is you can talk to any person in this world across the globe. For example, a person with epilepsy specialist is sitting in AIIMS or Guntur or somewhere, you can talk to them and at least take an opinion. For this, we have started something called as Epilepsy Online Help, where we are trying to help people across India to have a doubts or diagnosis, second opinion, and whatever you call it, so that they can clarify whether they are on right medications or not. So all these things becomes very, very important. The third important thing is access. When once you have an access to the doctor, there is something called a regular follow-up once in 2 months, 3 months, 6 months, or something like that, which is very important because that keeps them motivated to continue the treatment. They will understand the side effects of the medications what they're using, because monitoring the treatment as well as the side effects of medication is very important. As Madam told, someone suddenly becomes pregnant. They don't even inform us that they are becoming pregnant. They continue to take medicines which are not safe in pregnancy. So this is very important that they need a follow-up. So the follow-up can be very easy on digital platforms and telemedicines. The third important thing is we can even educate the primary caretaker, primary healthcare professionals, ASHA workers, Anganwadi workers, Ayush medicines, which is another field which is managing patients along with allopathy. So we can educate these doctors by sharing some videos or some case-based discussions or some CME forums or direct one-to-one contact. So there are three things which we can do in telemedicine. So it is going to have a very positive impact on people who are already suffering from epilepsy, and also helps us to follow them for a long term so that we can treat them better and improve their adherence and monitoring.
Correct. So we'll discuss this further, that how can digital innovation through mobile apps and everything change the entire story. So my next question is to you, Miss Varsha, that how can families, school and workplaces become better support system for individuals with epilepsy?
Yeah, I'll just reiterate what actually Dr. Vijaya and Dr. Shiva said. That awareness, I think, education and awareness are very, very important. And that's something we considerably lack as a community, I think. Because there's half the time goes into, people not knowing what to do, whether it's the patient themselves or even the families, or like you're saying, even at schools or at workplaces. There's a complete lack of awareness of what to do when the seizure happens, what to do after it, and even before, like what are my triggers, what could lead a situation or my state of mind that can lead to having a trigger, and then is being a trigger and then leading to having a seizure. So I think the education was my number one point as well, to educate ourselves, not only the people who are experiencing, undergoing the condition of epilepsy or their families, but I think a basic level of understanding and awareness ought to be there in the community. So that's the first thing, and especially I think we really shy off in cases when we have a younger child, which is also again epilepsy pretty common in young children as well. So when there is a young child or an adolescent, we often shy away from telling them, what's happening to them and what they can do. And I think that's very important to even educate little ones about it. Let them know what is their condition, and they surprise us. We feel ke bahut chote and we should not say anything, but they surprise us, and they're actually far more resilient in their approach, and they will be very self-sufficient and self-equipped as well to deal with their condition. So and what to do, and also be responsible of making sure they take their medication on time, like our doctor suggested that it's very important to take that, undoubtedly. So to take their medication on time, to make sure that they're sleeping well. When they're feeling upset, they can express that. So it's important. Only people are educated around and aware of what are the symptoms, what are the triggers, that we can have that open dialogue and that honest conversation there. Secondly, I think self-management skills are very important. So to have the skills, and either families help that, or we come to professionals for that, and how to make sure that you keep yourself calm and the anxiety level stays at bay. Like Dr. Shiva said, that it is a vicious cycle. So if we keep our anxiety levels and moods at on check, then it will help in the overall recovery and the frequency of having an episode there. So when, if say for example my trigger is I get very stressed when I'm overburdened, I have too much say homework, or I'm an adult and I have too much work at office to do, and that could be one state that increases my stress levels and thereby anxiety levels. So if I'm aware of those triggers, and I have my self management tools in place, then I will be able to keep myself and my mood and my emotional being and mental health being in check. So that's an important aspect to also have. Also, in whether it's a school space or it is a workspace, I think we all have health workers around. So there you have your nurses or you have some visiting doctors, and it's important to have those health workers aware of your condition, so that in case there is a situation that occurs, they know what to do and they know what is happening to you. So to be more open and in discussing about it, and not to treat it as it's hiding thing, and not to be told to anyone, because only if we are open and sharing about our condition, only then will we also be able to receive the right kind of help. Another factor is also then, like I mentioned, that it leads to a lot of social isolation as well as social stigma. So if when we are open about what our condition is, and the limitations and the troubles that come with it, then it's also important to allow ourselves to put ourselves out there and go ahead and do the activities that we wish to. We can initially take, say a family member, or my peers are there with me, and I can let them know that, hey, if I'm not feeling well, just make me sit down and just do this and do that. But it's important to, have that independence and that self-sufficiency within yourself, and that also helps uplift our mood. So if we have the sense of, what we need to do when we're out there, and we also have a support system in place, then it will not hinder us in any way, and breaks automatically the social stigma as well as the isolation that comes in. And lastly, we've been talking about how families and schools and other people need to, be there as a support system, and of course, undoubtedly, that's important, because I don't think anybody, whether it's an adult or a child, can deal through this situation by themselves. It's always good to have someone with you, but it's equally important for the carer, who we call it, the person caring for the person who's suffering from epilepsy, to also take care of their well-being, because being a carer can also be exhausting, especially in cases of younger children. The parent will always be there and on high alert. So there are support groups for also carers, who can go and just share and offload, and maybe even get a support system for themselves. So you are the support system for the patient, but you also need your own emotional well-being and support system there. So it'll be recommended for carers to also give themselves a break, and to take some time off and indulge in activities that and things that give them pleasure, and make them feel calm, because we want a calm environment for recovery there.
So, yes, I'll take up my next question to you, Ms. Rupal, that what features or innovation in mobile apps or digital platforms can make epilepsy management easier for patients?
Currently, as we all understood, right, from different aspects of caregiving, at a doctor level, patient level, family and community level. So, different applications and tools that we are creating, and the ecosystem is building, from wearable devices for early seizure detection. IoT devices are there currently in the market, yet at a very sort of early stage, I would say, available to the patients. So there are early detection tools available, and we are working on that. Some of the beyond just the beyond the detection, now the treatment observation and monitoring, remote treatment, particularly digital diaries, seizure diaries, medication reminders, appointment. A lot of these tools are again can help with respect to the treatment and follow-up management. Then comes there is further investigation, particularly for people who have again diagnosed with epilepsy with medicine and continue to have seizure, drug resistant epilepsy. There's tremendous amount of medical imaging data comes with it. Then there are other awareness tools and data. What we have done is created a complete ecosystem where all these multiple data sets are fed into a single platform. The data is then presented. So the technology has bridged or made the connection between different caregivers, uh, aggregate all the data, present it to the doctors, a neurologist, as Dr. Shiv Kumar mentioned, that patients are in remote, doctors are in the cities, metro cities. So the technology platform like MedVirtue so can bridge this gap, so that they can discuss their entire case. They can do doctor to doctor consultation. So technology can be, and platforms, a unified ecosystem platform like MedVirtue so and others can facilitate easy caregiving, centralized data which is accessible to all caregivers into a single platform, is where I see technology has played a huge role. Artificial intelligence, we do it at MedMa. What we've done is particularly focused on identification of source and localization of seizures. If you can identify, multiple problems can be solved at different levels. So that's where we see a lot of innovation is happening currently, bridging the gap from clinical research to actual applicability of the science at the clinician level. So clinicians need to implement that and technology is helping us to innovate a lot of these solutions. Thank you.
Yeah, so thank you so much. My next question is to you, Dr. Vijaya, that if you could recommend one major system level reform to strengthen nationwide epilepsy care, what would it be? Ma'am, you're on mute, so you'll have to unmute.
Yes. So
Yes.
let's say that we should have a registry, national registry of all the people with epilepsy, especially the primary causes. The secondary causes are only temporary, that we treat them and they are become all right. That different category, especially in children and young adults where they are affected with a primary type of epilepsy. We should have a simple registries and follow them up diligently, and if needed to all the needy patients, poor patients, give the medicines at the doorstep, give it in their home, and make sure that they um, take them regularly by the ASHA workers or the community health workers, and monitor means once in a while, and when required to have a hub and spoke connectivity with the academic centers, so that the entire health system of care will be geared towards taking care of the epilepsy patients, whether it is children, women, or pregnant women, or other general population with epilepsy, to have a unified protocol based management with simple medicines. See, the not always we need to use costly medicines. As Dr. Kumar was saying, 70% of the time, simple first line or second line medicines suffices in most of the patients. They can be given very cheap and given also free. Just like we are having the tuberculosis program where we identify the patients, follow them up, to give them medicines as well as support. And this is the one important thing the policymakers, along with the physicians and NGOs, should do it. And the second, there is nothing like one time solution, as you know. At least two things we should do. The awareness thing. Again, the entire system should be live with the awareness things. At every level, we should be doing the awareness in the proper way. These two are my suggestions, and I thank all of you for this beautiful session. And if I don't cannot stay till the end, kindly excuse me. Thank you all. I'll stay
Uh,
till whatever time I can. Yes.
Sure, sure, ma'am. So, thank you so much for suggesting those changes. And to take this forward, my next question is to you, Dr. Shiva. That I mean, since you're working in the clinical practice, so what would be some key elements or something that you would suggest that should be included in the National Epilepsy Guideline, firstly, and then secondly, what steps can be taken to empower these primary health and community health workers to better support epilepsy management?
Okay, so I'll answer this question in two parts. One is the primary care doctors who are going to treat the epilepsy people in the rural health setting, particularly the rural health setting, and then the community workers. So first, let's come to the community workers. Who are these community workers? This can be school teachers, this can be local leaders, this can be volunteers, or this can be some kind of a healthcare associated people like Anganwadi workers, ASHA workers, Ayush practitioner, Ayush, or RMP doctors, whoever is practicing, may not be related to allopathic medicine. So, community workers, we need to educate them about how to identify epilepsy first. And if they have identified epilepsy, who is the right person to treat the epilepsy and whom it has to be referred. Or the third thing is that once they know that it is epilepsy and it is not probably treated or difficult to treat, then they should be sending them to a center where there is a specialized care for epilepsy people. So these three things are very important. So coming to the schools, as already was discussed, I think the epilepsy education should be a part of the curriculum to the students as well as the teachers, because that is where the young minds take up ideas and they develop a lot of bonding or maybe refusal, or maybe they are scared to treat people. We have seen children where they are made to sit away from the normal children in schools, or they are told that not to mingle with the child who has got epilepsy and behavioral problems, or sometimes they say your child has got epilepsy, please don't send to our school because other kids are getting disturbed. So this is what we hear some of the stories in our practice. So it's important that the school friend or the boy or girl who is sitting next to the child who is suffering from epilepsy should know that it is a treatable, manageable medical condition, and these people require special care only in certain situations, and rest of the situation they are as normal as them. They can learn, they can write exams, they can do everything, they can participate in sports. So this is very important. So the fellow colleagues in school, school teachers are the building blocks of creating ideas or whatever thoughts in the young people mind. I think we should educate them as much as possible. So we should go to schools, colleges, give them more awareness about diagnosing and taking care of the people who are having epilepsy. The next part is the primary healthcare providers, which I told you, the doctors, or the non-allopathic doctors. How we can engage them? We should have a curriculum for epilepsy in the graduation days itself, like MBBS. If you ask me, when I was a graduate in MBBS, there was no curriculum for epilepsy in my whole MBBS curriculum at all. So indicating that the importance of epilepsy was not given in the MBBS days. I think it should be integrated into the primary, maybe first year, second year, third year MBBS, how to diagnose epilepsy, how to treat it, and what are the myths and misconceptions we have or we have carried forward has to be misfelt, and we have to re-educate them. As Madam was rightly pointing out that our own colleagues doesn't know how to diagnose epilepsy, how to treat them. They even don't know there is something called treatable treatments, like maybe an epilepsy surgery or something which is required, or they should see a psychiatrist only for psychiatric problems, and they should see a neurologist for epilepsy control. So we have a lot of confusion on this. I think educating them is very important. How we can do that? One is by asking them to regularly reach out to the specialist, maybe in a CME forum, or maybe online case discussions, or online CMEs which can happen, or they should be given some credit points for attending such kind of courses, which should be free of cost. So whenever they attend such kind of course, they should be given some credibility that they are empowered to treat epilepsy like any other disease. As we all know that the primary care physician, like MBBS doctors, can treat heart attack, they can treat so many diseases, diabetes, everything. But when it comes to brain conditions like stroke and epilepsy, they are scared. Why? Because they don't have confidence, or they don't have the knowledge which is required for them to treat epilepsy at this point of time. So empowering them and telling that you are empowered, you know, have the knowledge to treat them in the initial stages is very important for us. And the last point is that there should be a guideline which has to be circulated among all the doctors. A simple epilepsy has to be treated like this. If you don't know how to treat epilepsy, you should follow certain videos or forums or certain protocols. And ultimately, if you're having a difficult case or a complex case, you should refer to a doctor who is a specialist or a center who is dealing with epilepsy cases. This is the curriculum which we should be giving it to the primary care. Then I think to some extent we can improve the epilepsy care.
So, yes, thank you for explaining it to us. My next question is to you, Ms. Varsha, that what are some practical steps that could be taken to make mental health support a routine part of epilepsy care?
Like you had just very rightly said, Vaishnavi, that I think forums like this to begin with are a platform, a very good platform to not only understand, because I'm hearing from the doctors that there's so much unawareness also about epilepsy and so much more to learn for each one of us about it, that I think not only to bring out the mental health aspect, but also understand what the condition is as well. Such forums like this, and I hope more organizations, and we have a far reach and we can reach the masses to understand the condition as well first, and then kind of understand the comorbidities along with it. The second thing is to also then work as a team, I think, because no condition is exclusive of just being that, like you're just having seizures here, like we've discussed. You know, there are so many other emotional well-being issues that are connected with it. And so to be able to identify those and work as a holistic and give a holistic approach to the patient, I think would be something that I would strongly, strongly recommend as well. Maybe each patient of epilepsy may not need as intense care from, say, a psychiatrist or a psychologist, but I'm sure many do. And so it'll be good to screen, at a level, to be able to screen who is the one, who are the ones that are maybe experiencing a lot of anxiety or feeling very worried and overly concerned, and it's interfering in their day-to-day functionality, or they are not able to even kind of do their basic tasks, not able to go to work, not able to concentrate at work, not able to go from point A to point B. So I think it's important to at the primary level only do the screening of who are the people who need that extra support and guidance, and be able to give that holistic approach, like I was mentioning, to the patient, because like we understand there is a deep rooted connection between this particular neurological condition as well as one's mental well-being. So that will be also something highly recommended, and I think also for possibly the patients to be educated in, as well as for them to also take these manage their own lifestyle and bring maybe some changes in their lifestyles that will that will help positively in their mental health conditions. So simple things like keeping themselves active, or whoever can, and going for maybe regular exercising, no matter how, just for a walk also. You don't have to rigorously do a gym training or something very strenuous, but just keeping yourself active, making sure that you're sleeping well, you're prioritizing your sleep, you're getting your rest. You have self management techniques of keeping yourself calm, and being able to identify when your levels of stress or worry are going up and down. Eating a balanced diet, just taking care of some very basic lifestyle things will also benefit one to just have to feel that there are certain things in my control. Because like I was initially mentioning, it feels so helpless in that condition, and how one restricts themselves, that to have these basic things in one's own control and be able to manage them just boosts the morale up. And it helps, and of course positively helps in the emotional and psychological well-being as well, over there. So I think that is these are some definitely changes that one should implement in the system as well as in oneself. But also, I think most importantly is about also helping them accept their condition, because it's often very difficult, and very scary, like we've been talking about, to accept what is happening to you and why is it happening to you. And so to just kind of calm it down and to ease it down and to explain the condition to them, or maybe these websites and apps or AI tools, of course, are going to help in that. To openly talk about, which will actually equip the patients to go out and openly talk about what are their limitations, and what are their needs, and therefore be able to ask for them. And that just lessens the burden that an individual carries about, what my condition, oh god, I cannot tell anybody, or what do I say, I don't even know what to do, what do I tell them. So it just eases down in general the vibe, and for yourself as well as out there when you're sitting in a room with people, and the social stigma also kind of comes down, because you're very openly and very categorically, very factually talking about your condition. So I think it's very important for the patient and the family to kind of accept their condition, which will of course come only through education and maybe reading more, or going through these tools that are there available in the space. And any queries, anything needs to be dealt with to help them feel at ease there, and bring about a more cohesive, holistic approach to working with patients of epilepsy.
Right. So, since we are heading towards the end of the session, and my last question is to you, Ms. Rupal, that how can organizations use digital solutions to promote inclusion, training, and support for people living with epilepsy at workplaces specifically?
So, as we rightly said earlier, also creating digital campaigns, tools through education, we can empower the HR department, the teams, to understand epilepsy, the seizures, the first aid symptoms, identify them. What are they can establish standard operating protocols about within the organization, first aid responses, so that the organization or the even the academic institution can enhance the entire workspace from being a fear oriented workspace to a more inclusive environment for epilepsy patients, and look at the people from more skill and knowledge and progressive in their career approach to looking them as a medical affected person. So a lot of these kind of changes would bring tremendous impact in building the confidence and skills of epilepsy patients, particularly. And one policy approach, and our reach out from a technology company or perspective would be to bring all the caregivers, be it institutions, academic, corporate, to come together and create a unified ecosystem where a lot of this data can be shared across multiple caregivers, primarily across academic institutions, clinical research teams, corporates, and build a consented, safe environment to share data, so that we can all work collectively and bring out some effective solutions which are applicable on the ground.
So, yeah, since we are heading towards the end of the session, I have a quick wrap up session wherein I'll be asking one misconception and or an advice that you would like to give out to the live viewers who are viewing this session. They might be having a condition or they might be knowing somebody who has this condition. So, what would be that advice or a misconception that you have come across in your day to day practice? About this condition. So, I mean, Dr. Shiva, you can go first.
Yeah, so one of the most important misconception is that every seizure you have to shake, you have to fall down, you have to have a tongue bite. All these things is a major misconception when I see in my patients. So to tell you the audience here that all seizures will not be the same, it can be different. The seizures can be subtle, or it can be even undiagnosed, or it cannot be recognized by a person who is sitting next to you. We have difficulty in diagnosing such kind of cases in spite of we being working in this field for more than 12 to 15 years. So what I would like to say is there are spectrum of epilepsy disorders where you have various manifestations, but the most important clue for the audience here is they are stereotyped. Stereotyped means they will be the same each time it happens. So anything which happens like a recorded version of an event, unless proved otherwise in clinical practice, we take this as a seizure or epilepsy. So there are more than 35 to 40 types of seizures. Every seizure will not result in fall or injuries. So be careful. If you have a suspicion, reach out to the right person for right diagnosis so that you don't delay the treatment and you can avoid the stigma which happens in your school or public place. Thank you.
Thank you so much. So, Dr. Vijaya, you can go next.
The second myth is when the person has a seizure, they remember all the movies and then they start keeping keys in their hands, or they try to show the chappals smell. And these are very common. And many people believe they are the treatment. So please don't have any such misconceptions. Whenever if you see any person lying down with the seizure, for example, in a mall or any other in a place, please follow certain rules which we all always teach the patients and the caregivers, and it should be displayed in public places also. Just to keep the patient safe with a side, turn the person towards one side, keep a pillow or a small soft towel under the head. Don't try to keep or put anything in the mouth, and then just may allow the person to breathe. Don't overcrowd. Don't try to stop the seizure. Don't forcibly do anything. So these are the simple things. If you follow, within a few minutes, the person will stop the seizing and they become normal. Once they are normal, they recover, they can shift to a doctor or a nearby emergency area. Don't try to do anything to the person when the patient is having a seizure. Especially, don't put anything in the mouth, don't put anything in the hand. It doesn't matter if they try to pry open the hand and then they try to forcibly do these things. This is another very common myth that many people have. There is a safe management for the seizure emergencies.
So, thank you
And
so
there
much.
is a, I would like to just inform everybody, including our panelists and of course the public, there is a very beautiful booklet by the WHO, how to improve the lives of, Dr. Shiva Kumar must be knowing, how to improve the lives of people with epilepsy. They have tried different models. I think as we already discussed, the teacher model is very important because teachers are the people who tell the students and the students believe the teachers. We have to sensitize the teachers that to take the epilepsy as a normal disease and to make that important to all the normal children, not to avoid the kid with epilepsy. And these are very important. One of the models mentioned in that booklet, in addition to the things that we have discussed. Thank you.
Yes. Thank you so much, ma'am. So, Miss Varsha, what would be your thoughts on the misconception or an advice that you would like to give?
So I think a misconception is that one feels very handicapped in this condition. That like I was saying, we can't do anything, can't go anywhere, can't live life as we would like it to be. And I think this is something I've commonly found
Hmm.
in patients that I've seen. So I think this is a big misconception that we carry. We of course need to be aware. We need to know what's happened. We need to be aware of our condition and accepting our of our condition. And then it is no such handicap. It does not really restrict us from life. And like Dr. Shiva rightly said, there is a spectrum of it, and everybody will not experience the same sort of a seizure. So be aware of your condition, know what you need. If you are in a known space, equip the people also around you to how they can help you, what they need to do, and do things that you are comfortable doing, going out, leading your life as normally as you would want to. It is nothing to sit back and stay home and kind of stay in isolation or limit yourself from doing anything. Of course, under the doctor's advice.
Done. So yeah, over to you, Ms. Rupal. That what would be your one take away home message or a misconception that you have come across related to epilepsy?
My takeaway from the discussions here is that let's treat epilepsy patients. We all can make ourselves very aware, just like how we did for CPR for the cardiac arrest patients, right? We all learned through the videos and all just to do the first CPR. Similarly, first aid to epilepsy patient can become a social responsibility for each and every individual in the country, so that people with epilepsy do not feel afraid to even step out alone. They know that care can be available to them at any point, and that could be a very big support, in my opinion.
So yes, I extend my thanks to all of you for making out time and joining this session on the occasion of National Epilepsy Day. And I hope and wish that forums like this does the part of helping in overcoming such condition and the management of it. So thank you so much for taking out time and joining the session. We look forward to have more such forums on topic like these. So thank you so much.
It's our privilege to be part of the forum and with esteemed panelists. Thank you so much, everyone.
Thank you. Thank you.
Thank you,
Thank
everyone.
you.
And I really enjoyed this program. Thank you.
Thank you.
Thank you.